All right, so what is a drain and why do we use it? Well, I'm going to show you exactly what a drain is and how it works and what it looks like. Right here is our silicone bulb drain, basically also known as a grenade, but this is what collects all the fluid through a tubing, and you can see it course around here into our working end of the drain, which now collects all the fluid. You can see all the holes on the distal part of the drain, and this is where the blood or fluid is collected under suction, and then it travels down here and collects in our reservoir here. Now create suction by squeezing the grenade or the bulb like this, and we cap it just like this in order to create suction. If I were to let this go, listen to this. Now you wouldn't hear that in the body because it's going to be underneath the skin or fluid's going to be rushing into it, but that's how we create suction. The patient then will record how much is coming out. It's identified by little lines that say 25, 50, 75, and wherever it's at, they'll write that down on a piece of paper, what time, and let us know how much is draining over a 24-hour period. So that's exactly what a drain is for, or how it works, and we use it so we collect all that fluid that the body's not able to reabsorb by itself. But over about a week, then the drain should be done. We won't need any more, and we can remove it at that time. So now let's take a look and see how this drain works in action. So we're going to simulate this with a little cup full of some fluid that looks like maybe a little bit of blood. And so pretend this is going to be underneath the skin and in contact with the fluid. So we'll just dunk it here, and we got to get all the holes underneath. Just push that there, and voila. Now it's like it's in the body. We will have the patient squeeze this so we can apply suction here. Okay, we squeeze it like that and then cap it off here, and all the suction will be applied as soon as I let go. I'm just going to push this a little bit further and watch it. I'm going to let go. You can see the fluid start to come out. It's very clear, but see it's starting to fill up here? And it's slowly going. And once it fills, it's going to lose suction. So I'm going to show you how it loses its suction as it fills up. See, it's filling, filling, filling.
A few moments later.
All right, so typically we ask our patients when it gets to be about this full to go ahead and empty it. So all you would do is you unroof it like this. Now there's no suction. Now you can see exactly how much it is, and we're about 50 cc's. So the patient will write 50 cc's at this time, and then we'll pretend that this is now an empty cup. And we're going to pour the fluid back into the cup that will then be disposed in a toilet. We apply suction here. And that's doing its job. And we take this down to the toilet, empty it, and the whole process starts over again as we applied new suction and waiting for the new fluid to come out. And so that's all there is with a drain. So I hope I didn't drain you too much with all this knowledge.